Secretary Pryor, how do you, or I suppose, what's your recommendation to live music venues? You know, are they permitted to open up and have performers on stage without any kind of plexiglass barrier? How is that going to look?
A couple of different points. First of all, inside a venue, there's specific guidance for the performers and the audience. So the performers need to be 14 feet spaced from the audience. And there's specific guidance on that, as the governor indicated. Guidance that existed in phase 2 continues to exist in phase 3. There may be some tweaks here and there, but that would be an example. Also, musicians themselves have to be spaced, and there's a dialogue we can have with the industry about how that works. Then there's the question of the venue. So the venue, if it is indoors, for example, and it's greater than 250 seats, then there needs to be a plan, and that plan needs to be approved. More explanation regarding that process will also be available online.
Well, recommending that more than 250 people in an outdoor space is not a good idea, but also saying there's no cap. So was it premature for people to kind of cancel some of these larger summer events based on what you said earlier, or are you still sticking by that?
No, I don't think so. So first of all, at the time I said, so there are certain events, like the Newport Folk Festival, the Newport Jazz Festival, absolutely not safe. I mean, those are thousands and thousands of people close together for hours at a time. That's not permissible. It's not permissible even in phase 3, and so we figured it was the right thing to do so they could, deal with their business. Well, what we're trying to say is we don't think you should have events greater than 250. Like, we are not encouraging that. We are discouraging that. It's our job to, if the doctor, if we could have a magic wand and say there could be no events, we might go that way. But we're recognizing that, human nature is such, and there might be unusual circumstances where there might be a couple of bigger events outdoors, 250 people. And so in that instance, call us and let's work it out so we can make sure that it is a big enough space and everybody's far enough apart and not close to enough, and people can be safe. But to be clear, when we say an indoor wedding, an indoor wedding is, there's a safe number and then a little bit more risk. You just need to know that. If you're going to go up to the 150 outdoors, you need to know that's more risk than 50.
Just to be clear on the weddings, should guests be wearing masks?
No. Right? Always encourage it, but you don't have to.
And just to clarify on school mask wearing, again, for high school students within 6 feet under the full reopening plan, but elementary and middle school students would not be wearing masks?
We think it's impractical. So again, if you are a teacher who could convince a bunch of 6-year-olds to keep a mask on and stay 6 feet apart, God bless you, that is safer. That is the gold standard. But that's hard to do. So we're assuming that that's not going to happen, and so we're saying you have to, do these other things.
Are bars allowed to reopen?
So I'm going to let Stefan handle that. But there's restaurants with the bars, and nightclubs. Go ahead.
So bars are already permitted to be open in phase 2. There are specific bar operation guidelines that are available to help a bar operate in a way that is viewed as safe by the public health officials of our state. Essentially, it's restaurant rules. Seated service, no standing service, no congregating, and we're in heavy dialogue with the industry about how to ensure that that's operationalized. So bars are open. As the governor referenced, nightclubs are not permitted to operate as nightclubs, and there'll be more guidance on that point.
When you said there are no caps at 250, does that mean that that requires some sort of special approval, that if somebody wants to do an event that it would be over 250, they should ask the state directly and get special permission for that particular event?
Yes, we're asking venues that outdoors would have larger events as possibilities to contact the state if they wish to host events that are larger, and there can be plans on the part of the venue that would be submitted to the state and approved for indoor venues that know that they want to go in that direction. They should even more rapidly be in touch with us because they are required to submit plans. And we anticipate having to engage in dialogue with them and approve the plans. And that'll be a multiple department process, obviously always involved in the Department of Health.
But can I say one thing quickly, and we'll answer whatever. This is important and it's different, and I want to make sure I hammer it home. What we're trying to do for phase 3 is make a distinction between social gatherings and what we're calling places of public interaction. So a social gathering would be a wedding, a birthday party, a family party, where you have mostly people who know each other, who are all going to be congregating with each other. And so that's to Brian's question, the wedding. So for example, so that is maximum 150 outdoors. We're calling a public place of interaction, you may be calling an event. So an event, a public place of interaction would be 4th of July activities hosted by a municipality, a festival, something else where people don't know each other, but they are all going to the same place. That we are saying there's technically no cap, but we don't think you should go above 250. Outdoors, this is outdoors. There's technically no cap. We don't really want you going above 250, but if you really have to do it in phase 3 and you really have to go above 250, please call us so we know what's going on, so we can look at your plan and make sure you do it in a way that is safe. And principally by safe, we mean it's in a big enough place so people can be far enough apart.
Where does phase 3 begin and what could change that?
Okay, when does it begin? What could change that? So my executive order for phase 2 is set to expire on June 29th. And I am optimistic that when that ends, I can do a new executive order to begin phase 3. What could change that? I mean, the data that we'll be getting in between now and the 29th theoretically could change that. So, we did have large protests a couple of weeks ago. Folks are going out and about a lot more. So if we start to see things that are very concerning in the next 10 days, then it might give me some pause. But that's, that executive order expires the 29th, and it would be, I'm hopeful that I could do a new executive order to then begin phase 3.
Governor.
Phase 3. Sorry.
Governor,
phase 3.
with the One Rhode Island Fund, what qualifies in your mind a Rhode Islander? We know they're not a citizen, but if someone arrived last Saturday and they set up shop here in Rhode Island, are they a Rhode Islander?
Yes. Yeah. I mean, you can apply, and we have these organizations that are, distributing the money. It's on the basis of need. So you have to demonstrate that you have need. You have to demonstrate that you've been here affected by COVID. So probably if you just arrived, no, that's probably not a good example. But these are people who've been living here, living through COVID, maybe lost their job through COVID, who are here, who are residents of our state, many of whom who work here and actually pay taxes here through their job. And they can kind of attest that they've struggled because of COVID in Rhode Island, and then they'd be eligible.
But we have high unemployment, people have lost their businesses, and essentially a fund of $3 million for people who are not U.S. citizens. Is that correct?
That is correct, but to be clear, other Rhode Islanders have been eligible for many other kinds of benefits. Every other federal benefit, the COVID relief fund, the extra $600, all that stuff. So yes, that is correct.
It's all private.
It's all private, exactly. Zero taxpayer dollars.
And just one more question.
Yep.
Mayor Elorza had a ceremony. He's lifted Providence Plantation from the city of Providence. I asked you last week about that. You said definitely in favor of the ballot. Have you thought now in this week maybe do executive order the same thing?
I have. In fact, I'll have some more news on that on Monday. I'm planning for Monday. But I was very, very pleased to see the Senate passed a bill to remove it. I'm hopeful the House does, and I hope it goes on the ballot this year. And if it does, I'll be stumping for it. But on Monday, I'm going to be making some other announcements on that.
Yeah, I have two questions actually for Dr. Alexander Scott. The first is on nursing homes, and I'm really glad that there's going to be an announcement next week in regards to the plans. I've heard from a lot of families who are upset that you can go to a casino, you can go to a strip club, but you can't see your loved one, and it's been like this for months. Can you give us a preview of what you're looking for and the plans when people can anticipate being actually able to see their loved ones in person?
Yeah, it's definitely an understood frustration and something that's been hard for us as well, because we recognize the importance of the emotional well-being, being able to see your family, as well as the physical well-being. The challenge that everyone has, though, which was why we have been at this point, is how critical it is to keep such a fragile population safe. What we've been doing in our interactions with nursing homes and assisted living is provided them guidance about 2 weeks ago on how to develop an individualized plan for visitation. We'll be working with them over the next several days to couple of weeks to begin implementing, to begin thinking about how they want to approach it, provide more information about what steps they should do, and it will be a phased process. It also plans to be in alignment with guidance that CMS has provided, Centers for Medicaid and Medicare, that oversees and works with us in providing guidance to nursing homes. So we'll want to make sure that nursing homes and assisted living have the resources that they need to take a phased approach to make sure that families can visit, but do it safely, and ensure that we continue to keep our hands wrapped around this population, knowing the risk that will continue to be in place throughout the rest of this pandemic.
Is it reasonable to think that people will be able to actually have these visits, say, next month?
And next month being July, yes.
Okay. My second question for you, getting to the protests, I'm one of probably many people who got a COVID test because of being at the protest. Have you looked at the data from people who attended those protests? And if so, what is the rate of infection?
Overall, the rate of infection is very low at this point, less than 1% or so. We continue to encourage as many people who have attended protests, so I'm glad that you did as well, to go ahead and get tested. We continue to encourage, regardless of your test results, to monitor yourself for symptoms. That window for monitoring extends out to about 14 days after the time frame, and we'll continue to assess. I am encouraged. I know particularly the very large protests that we had at that finished at the State House with over 10,000 people, where we handed out over 5,000 masks. The overwhelming majority of people were masked. So I'm very encouraged that that core tool, masking that we talk about, distancing, that works.
Governor, we're seeing alarming rises in cases in states like Arizona, Texas, Florida, that in many cases were more aggressive about reopening. Without really pitting states against each other, I assume you're keeping an eye on that, and what lessons so far have you taken from those states' experiences at the moment?
I'm keeping a very close eye on that, as you might imagine, because it's scary. It's scary. You go through all this, and as I understand it, hospitals are full in Arizona, or parts of Arizona, and planning for their surge capacity. And it's, first of all, it's just a reminder to all of us, don't get complacent. It can change like that. We learned that when we were, it's fresh in my memory, you go up the curve really fast. Once this thing starts compounding, you go up the curve really fast. So my mantra is stay ahead of it. If you let it get ahead of you, it's really hard. In any event, you point Arizona, suddenly hospitals are full. So here's what I here's my takeaways so far. If you look at these places, Texas, 45% of new cases in Texas are from the prison population. They have a different prison system, county jail system. So that tells you one thing. North Carolina, similar. It is specific to certain counties. If you look at the different states where they're having issues, it's mostly in particular counties or settings where they are having trouble in either communal living, prisons, nursing homes, meatpacking plants. There have been big issues in meatpacking plants, or some other population which is densely populated where, you know, if you take your eye off the ball there, it spirals quickly. So now, in contrast, you look at a place like Ohio. I look at Ohio's data and I take heart because they're quite similar to us. They've had a broad reopening like us. They're actually a little bit ahead of us, and they haven't seen any spikes. So I think you can't say a broad reopening will lead to a spike. But what you can say is, don't get lulled into complacency by looking at a statewide low test positive rate. Because even if you look at Arizona, Texas, Florida, their statewide test positive rate is below 10%, low. But they have counties or areas or instances of communal living where it was clicking up, and they let it get out of control. So that's why I'm obsessed with looking at our data in our nursing homes, in the ACI, in Central Falls, Providence, and Pawtucket. That's why I'm upset. That's why I'm begging people who work in close and contact businesses to go get tested. If we get into trouble again, you're not going to see it in a high test positive rate in the state. You might see, you'll see an outbreak in a particular community. So a long-winded way of saying, we know this thing thrives in density. We know there's certain communities that are at higher risk. And even though our test positive rate is extremely low statewide, we better keep our eye on those areas.
Given that it's been 2 weeks since that large protest and you haven't seen an apparent spike, has that changed your thinking? Did it factor into some of this decision-making about what can be allowed outside? And what do you say to those people who've been saying all along, like, it's not a big deal outside and we should be allowed to have large groups out there anyway?
So what do I say? So it makes me, I feel relieved, honestly. My real emotion is relief. I was worried. I still don't, I'm still waiting, holding my breath for another week or two, although all signs would suggest it's fine. But as the doctor said, mostly everyone was mask wearing, and we were passing out masks and hand sanitizer, and I think it's pretty clear that that was successful.
James. This question, a couple questions for Secretary Pryor. Secretary Pryor, James Passett from the Providence Business News. You laid out as part of the plan as to what some of the things are for indoor recreation, but what about like, say, trampoline parks and indoor roller skating rinks? Do those fall in the guidelines for be eligible for Phase 3 to reopen?
The category of indoor entertainment and recreation is now allowed to open. For individual activities where there could be contact between customers or where there otherwise could be challenges, we encourage the operator of the business to contact us, meaning through the Department of Business Regulation, and they'll consult with RIDO. So you mentioned, for example, a trampoline business. If it's a situation where it's just hard to know if people will be in contact has generally not been permitted either in the gym fitness context or in the recreation context. But we encourage them to call us if they think they hit one of those barriers or exceptions.
Okay, so what about like roller skating rinks?
Same. I wouldn't know enough about their operations, so they should call us.
Okay, so
Yeah.
So they're technically part of Phase 3?
They're permitted as indoor recreation. Indoor, I assume, could be outdoor.
Indoor.
they're permitted, and if they have questions, they should contact us.
Okay. I talked to a couple other indoor recreation places, and they said that they've been having for immense trouble getting in contact with anybody at Rhode Island Commerce or the Department of Business Regulation since the beginning of May, just to try to find out where they would stand. Even though in early April the state kind of laid out at least a kind of like a basis as to what phase 1, phase 2, phase 3 are. Has there been a big backlog at like Department of Business Regulation or at Rhode Island Commerce that's not been able to kind of get these questions answered to people, even though the state's kind of been directing them to contact DBR or Rhode Island Commerce to get this? Because they said that they've been waiting several weeks, and some of them have not been able to get an answer until at least today's press conference.
There could be exceptions to any general rule, but we've been very carefully monitoring the inquiries about businesses and whether they can be open and what the guidelines ought to be for them when businesses call or email. DBR receives those. They're all directed to DBR ultimately, and DBR's turnaround time has been very good. Usually within a couple days, handful of days to real substantive communication. If there is an exception, let us know. Sometimes what happens is a business owner may try to call different agencies, and they may get the answer out of DBR, but they may still be seeking more guidance because the outcome wasn't what they expected or wanted. But that easily could not be the case. This could simply be an exception that you've heard about, and we could have not gotten back to them, so please let us know. But we see spreadsheets of inquiries coming in and very good turnaround time on responses. And most of what we've heard from individual businesses is even if they didn't like the answer, they were pleased to get an answer.
Okay. And then the last one for me is kind of a follow-up of what I asked on Wednesday is R1 Indoor Karting in Lincoln, which is an indoor go-kart track.
Yes.
They've reopened as a week ago today, and they're currently in business now on a limited basis. And among the reasons that they cited is Twin Rivers opening. So is R1 in any potential violation of state protocols for being open in advance of phase 3? And how should similar entertainment facilities that have been waiting up to this point to receive phase 3 guidelines proceed with R1 being reopened, and also in addition, Twin River already been open?
It would be very hard for me to speculate about any particular case without knowing everything about an individual business and whether they're truly reopened and how they're operating and whether they're within guidelines. So let me not comment on a specific business. Let me say this. If you're an indoor entertainment business, you may reopen by June 29th if we stay on track with the governor's plan. The governor and Dr. Alexander Scott need to evaluate the data between now and then, but assuming that, they're eligible for phase 3. So that's what I would say. You asked what would we say to such businesses. You will be permitted to reopen by the turn of the month.
Okay, so R1 wouldn't be allowed open at this time?
I'm not going to try to hypothesize whether they could or could not be open based upon your question. Reasonable question. Let me look into it.
Okay. Commissioner, I just want to ask, Commissioner, based on what's happening right now, have you given any thought to special guidelines that what should teachers teach children about the history of slavery in our country? I just saw a video where they ripped down a statue of George Washington. Is this something that we should relook at in some way?
Oh, absolutely. I think we have to look at how history is taught. And I think history is taught from different perspectives. And I think we have to do a better job of being inclusive of all the perspectives without saying this is the way that it is or wasn't. I mean, we do know we had slavery. We do know that communities benefited from slavery. And we still see the effects of it today. So I think that we have to talk about that. And the fact that Juneteenth is a holiday that we may or may not know about talks about the importance of us really looking at history. I'll give you a personal example. My son and daughter were playing Roblox yesterday. I don't know if you know what Roblox is. It's this online game. And somebody went on and actually told my kids that they were ugly because of their dark skin. That's a child. They're being taught that. So I had to sit down my kids yesterday and have a different conversation with them. So why is history important? Because it dispels myths that we have told ourselves to feel better about what's happened. We can't change the past. We just can't. We can only do better moving forward. And that's the work that education, the power that education has. So we have to do right by our kids. I have to tell you that.
Last Friday, there was a teacher arrested, charged vandalism of the Christopher Columbus statue. Deserves his day in court. But if that's proven to be true, is that the type of person who should be in a classroom teaching children?
I don't know. I don't work for law enforcement. What I do know is that there are different ways for us to protest or to talk about our what we feel is right or how history needs to be talked about. I don't condone anyone breaking the law in any way, shape, or form. But I think that we need to be very clear that we need to take a good, hard look on what we value as a community, as a society, and as a nation. And that has to, if we are really an inclusive nation, as we say we are, then we need to look at all the history that happens.
The financial problems at the state-run Eleanor Slater Hospital have caused some major budget issues in terms of what happened with the billing and the compliance. What do you have to say about that now? It's $60-something million, and the accountability there, and legislative leaders saying this was mismanaged by your administration and now causing a significant budget problem at a time when you can't afford it.
So that, I would say, is a complete mischaracterization, but we do have a problem and we have to fix it. Eleanor Slater is a unique hospital in America. It's the only one of its kind, and the way we have been billing for years and years, prior to me being governor even, has been called into question recently because, as I say, it's unique. So we have to fix it. I'm not saying we don't have a problem. I have a new director of that department, and we're working very closely with CMS, the federal agency, to try to change the way we do business at Eleanor Slater so that we can fix our billing problems. They highlighted it for us. It's been a long-standing practice of the state, and we have to fix it. Happy Father's Day to all the fathers. Have a great Sunday. Have a good weekend.